Question number 8 in the name of Deputy Sean Crowe.
Thank you very much. To thank Deputy Crowe for the question. I know Deputy O'Reilly is taking it on his behalf. I'm very conscious of the impacts that long wait times in emergency departments can have on patients and indeed their families as well as frontline staff. Last Monday I had the opportunity to attend my first meeting of the ED Task Force Implementation Group. This is a group co-chaired by the Director General of the HSE and Liam Doran of the INMO. This is providing focus and momentum in dealing with challenges presented by ED overcrowding, and as Minister for Health I intend to personally attend the monthly meeting to try and keep that momentum going. In June of last year, additional funding of €18 million was made available to the HSE under the Winter Additional Capacity Initiative. This initiative identified 301 additional winter capacity beds that could be opened. In some hospitals, as we've discussed already today, beds have proved more challenging to open than envisaged owing to the difficulties in staff recruitment. However, to date, 236 of these 301 new beds have opened. In addition, 116 closed beds have reopened and a further 14 beds have now been opened in Sligo. In total, 366 new or reopened beds have now been made available. This extra capacity has enabled similar ED performance to the equivalent period in 2015, despite, as the Deputy mentioned earlier, an average increase of nearly 6% in attendances in our ED departments so far this year. Furthermore, figures for May, the month we've just finished, show total numbers of patients on trolleys are approximately 18% lower than in May of last year, with the numbers waiting over 9 years approximately 24% lower than in May of last year. Not saying it's acceptable, but just putting a context in relation to those figures. The demand for acute hospital services continues to increase in line with the growing and ageing population. The overall population growth year on year is in the order of 1%, whereas growth in the over 65-year age group is in the order of 3 to 4% per year. In addition, in 2014, adults over 65 years of age accounted for nearly 13% of our population, but 53% of our total hospital patient in care, so just showing the demographic pressures on our health service. We need a review of bed capacity and we need a review of opening hours of medical assessment units. These are both key commitments in the programme for government. They're also key commitments from me as Minister for Health in terms of looking at ways of addressing pressures on our emergency departments. And as you know, I am planning a winter initiative not just for this year but also for next year, and planning is now underway in that regard.
Thank you, Minister. Deputy Louise O'Reilly.
18 million was spent. Thank you, Gael. 18 million was spent set aside last year for the winter initiative. Minister, can you advise us if the same amount or more is going to be set aside? Firstly. Secondly, we're 65 beds short of the target. 301 is what was promised. Where did those 65 beds go? Clearly there's nobody in them, they're closed, so we'd like to know where they are at this point in time. You mentioned the intention to undertake a bed capacity review, and that is very, very welcome. Can I ask, Minister, when that will start, when it will finish, who will conduct it, and if you have any plans or money set aside to act on whatever recommendations the capacity review, because I don't think that we need to spend too much time to know that there aren't enough beds in the system, Minister. So, clearly the bed capacity review, it should be a quick enough exercise, but we'd be interested in knowing if you have identified someone who will undertake such a review. Thank you.
Thank you, Deputy.
In relation to the winter initiative, I'm not in a position to reveal the figure today, but I will be shortly. I think the Taoiseach has made clear in this House, and the Minister for Public Expenditure and Reform has made clear in this House this week that we will be presenting our health estimate and indeed all estimates for departmental votes in the next fortnight here. And I hope they'll be able to provide clarity to Deputy O'Reilly in relation to that at that stage. But let me tell you, by starting the winter initiative now at the end of May, start of June, I hope it's seen as a signal of my intention and the HSE's intention to try and prepare for this in advance, but also to look at next year as well, because this is a crisis that happens year on year, and we do need to plan ahead for it. In relation to the closed beds figure and where did the 65, I think you asked me, go, as I outlined in the question, there have been in some hospitals in some areas difficulties in staff recruitment. You can't open beds without staff. However, there are now 366 new or reopened beds that weren't available in the system, now available in the system. In relation to bed capacity review, what has to be different this time is I have no interest in just carrying out out a bed capacity review for acute hospitals, because we can't keep on seeing the acute hospital as the beginning and end of every conversation. We've got to look at capacity in the community as well. We've got to look at capacity in our nursing homes, our long-term stay beds, our community hospitals. That bed capacity review has to look at the whole continuum of care and beds. I will come back to you with the time frame. I'd like it to take place as quickly as possible. I'd particularly like it to take place because I'm conscious of a review of capital plans next year, and I think I need to know the data so I can deliver in relation to that. Obviously, in terms of how I'll have funding to deliver all of these things, as I said, we have the estimate in the House in the next fortnight.
Thank you, Minister. Deputy O'Reilly.
Minister, we do need to know really who it is that's going to conduct the review, and I do welcome the fact that it will encompass all beds, because I think that there is a serious need to examine it. And you may already be aware that according to the OECD, we have below the EU average number of beds per 1,000 of our population. So, you know, we already have a deficit. I'm disappointed that the figure for the winter initiative is not being shared with us. And you're right to start it early, obviously, but winter is coming, Minister. You know, and the pressure on our accident and emergency. It used to get, and I would be familiar with this from my previous job. It used to get particularly bad. There were spikes, and now it's maintaining a level of difficulty, and the staff will tell you that when you talk to them. You know, there used to be times when there would be a lull. There are no lulls anymore, Minister, so I think the sooner the better. The bed capacity review is undertaken, and indeed all of the beds as identified are open, because according to our figures we're still 65 beds short, notwithstanding the other beds. Thank you.
Deputy.
And don't be disappointed on my first outing here. I don't want to disappoint you this early on in our exchange. You will know within the next fortnight, and in fact you'll know when I know, because obviously what we have to do, and the message I delivered to the ED task force on Monday of this week was what worked last year, what didn't work last year, what did we not look at last year that we should look at this year, and very much an important message to the HSE. Please do not see the solution to this as just one that rests in the acute hospitals. It has to involve the primary care divisions of the HSE, it has to involve social care, it has to involve the home care packages that Minister McEntee discussed with Deputy Kelleher earlier on. So we will have clarity on that for you in the next fortnight or so, and I largely agree with you in terms of bed capacity. What I do would stress, and we'll work with everybody on this, is we need to identify exactly where the beds are needed, and we need to also, as I say, look at that piece in relation to the delayed discharges, because sometimes there isn't an adequate infrastructure in the community.
Thank you, Minister. Question number 9.